Hi friends, I'm back again after a long time. Uh, we're going through right now the second wave of COVID 19, and we found very many differences between this wave and the first wave. We are seeing a far more infective virus. Earlier, when we were seeing a single member infected in the family, it was limited to that. Now, the entire families are getting affected. We are seeing younger people getting affected. We are seeing younger children getting affected. We are also seeing pregnant women getting affected. Although the mortality is not still more than 1.5 to 1.6%, but whatever we are seeing, the clinical presentation with this virus is far more severe than what was seen in the last surge or during the last wave. We are seeing early development of respiratory failure, and we are seeing that a lot more people are requiring high oxygen support during this peak. And we are also seeing another very important aspect, that is a lot of fear amongst everyone. Coupled with the negative media reports that we are running out of oxygen, we are running out of drugs, to some extent, they're not wrong. We have limited medications available. We have problem in procuring certain medications which have an off-label use and are considered at times life-saving, but they are needed in a very minority of patients who go up and end up at that particular stage. So one thing which I've realized in last 1.5 years of this pandemic is that all those who have stayed positive tend to come out, and all those who go into a negative mindset tend to suffer more. So look at the positive things you have. We still have a recovery rate of, we still have patients 85 to 90% who are having milder illnesses. We still have only 15 to 16% patients requiring hospitalization, and we still have very similar kind of mortality what was seen in the last surge. So these are the positive things to look at. Uh, Although there is certain amount of you can say resource limitation this time, but every one of us is trying to judiciously use whatever we have to the best of our abilities. We are getting tired, the healthcare workers are getting tired, the nursing staff is getting tired, not only because of the fact that they've been working for 1.5 years, but also because their near and dear ones are falling ill. They themselves are falling ill because of the increased infectivity of this virus. But we haven't given up. We still fighting hard, trying to do our best within the resource restraint which we have. And I will request all of you to please stand by us. We all are trying to do our best for the sickest of patients. We do succeed most of the times, but there are times when we are not. If there is a resource scarcity, if there is a resource limitation, it is not the doctor who's at the fault. Somewhere the administration, the government has failed to look at providing the adequate resources. The government is trying its best, but our limitation is the huge numbers, our own population. In the last surge, we had just 10% positivity. This surge, in some of the cities, the positivity has increased beyond 30%. So, a large number of patients reaching the healthcare facility has overwhelmed us. And as I said, resource limitation is a constraint. Stand with us, try to understand what we are trying to do as healthcare workers, not only doctors, not only nurses, everyone, all the paramedics, all the uh, you know hospital attendants, the sanitary attendants, everyone is trying to do their best to take care of your loved ones. Have faith and be positive. Another thing which I want to remind you is, please do not forget COVID appropriate behavior, because all the vaccines which are available even now are at best able to modulate the severity of illness. They cannot prevent infection, they cannot prevent milder infections. And at best, the vaccines have an efficacy of around 80%. So remember this, that none of the vaccines is 100% effective, and it decreases, the vaccine is meant to decrease the severity of illness. It will not prevent the infection, it will not prevent the milder infection. So these are the things which you have to remember. Stay safe, wear masks, use sanitizer, follow COVID appropriate behavior, and if possible, do not get out of your homes. Protect the elderly, because now is the time to save our elderly. They have limited resources and they go down very fast once they get moderate disease. So protect your elderlies, stay safe, follow COVID appropriate behavior, and stay at home as far as possible. I think that is the message which I would like to convey to all of you, and I expect all of you, the entire population of India, to stand up to this challenge and face this challenge. This too shall pass, and once again, we'll have better days coming back to us. Thank you.